Hello everyone, I am Seema Gupta, working as Assistant Professor in Ramesh Institute of Vocational and Technical Education, Greater Noida. I am going to deliver the lecture on pathophysiology. The code is BP204T. I am going to discuss with you Unit 2. Now, Unit 2 is basically, it deals with the diseases that are related to cardiovascular system and the diseases of respiratory system. So, first of all, in my today's lecture, I am going to discuss the disease of cardiovascular system. So, my today's topic is hypertension. Now, the content which I am going to discuss in this present slide, in this topic of hypertension, I am going to discuss with you the definition of hypertension, what actually is hypertension, then the stages of hypertension, then coming to the forms of hypertension, different forms of hypertension. Now, the etiology I am going to discuss, etiology it basically means causes. What are the different causes of hypertension, why it is happening. Then the factors influencing blood pressure, clinical presentation, the different signs and symptoms I am going to discuss. Then the pathophysiology, pathophysiology is the how the disease is affecting the functions. Then is the assessment, and finally, we will deal with the treatment of hypertension. Now, coming to the next slide, that is the definition. Now, what is the hypertension? See, hypertension, it is a pathological condition which is characterized by chronically elevated blood pressure affecting the heart and the blood vessel. See, chronically, the word this chronically, it means it is for a very longer duration of time. Like if suppose a blood pressure is increased for a very few minutes, like you are going to a doctor, sometimes the blood pressure suddenly increases, or if you are appearing in certain exams, then the sudden there is increase in the blood pressure. So, that is not called the hypertension. For a correct definition of hypertension, it is that the blood pressure should be sustained. It should be sustained for a longer duration of time. There is sustained increase in the blood pressure. So, that we called as hypertension. Okay. So, coming to the next slide is the different stages of hypertension. The different stages of hypertension, like if there are 3 stages of hypertension. Number 1 is pre-hypertension. In this pre-hypertension stage, the systolic blood pressure, now what is systolic? Systolic means when the heart is contracting, okay, when the auricles they are contracting. So, the systolic blood pressure is 120 to 139 mmHg and the diastolic pressure is 80 to 89. Okay. Now, the diastolic means when the heart is relaxing. Okay. So, this is called the pre-hypertension stage. That means, if a patient is having a systolic blood pressure of 120 to 139 and the diastolic blood pressure of 80 to 89, it means that the patient is pre-hypertensive. That means, a hypertension stage can occur in that patient. Then second is the hypertension stage 1. In hypertension stage 1, the systolic blood pressure is 140 to 159 when the heart is contracting and the diastolic blood pressure is 90 to 99. Then coming to the hypertension stage 2, in hypertension stage 2, the systolic blood pressure is 160, it is 160 mmHg, and the diastolic blood pressure is 100 mmHg. So, these are the different stages of hypertension that is occur in a patient. Now, coming to the next slide is the forms of hypertension. What are the different forms of hypertension? So, the different forms, there are 4 forms of hypertension. Number 1 is the primary. So, primary form is, it occurs in the 90 to 95% of the individual, and it is idiopathic. Now, what does this word idiopathic means? See, idiopathic, it means a disease which have no cause. Okay. So, idiopathic, it means a disease which have no cause. That means a patient is suffering 90 to 95% of the population, the patient, they are suffering from idiopathic hypertension. That means they do not know what is the cause of hypertension. Then secondary hypertension, it occurs in 5% of the cases. In a secondary hypertension, what happens? The secondary hypertension, it is mainly due to certain diseases. Okay. Like if a patient is suffering from any renal disease, okay, then the patient may be hypertensive, or a patient may be suffering from any thyroid disease or some endocrine disorder is there. So, then the patient may, it may lead to hypertension state. So, this is the secondary hypertension, it is due to certain diseases that a patient is suffering, and it may lead to hypertension. Now, benign hypertension, this benign type of hypertension, it is mainly, it is asymptomatic. Asymptomatic, it means the symptoms, they are generally not shown, and in benign hypertension what happens? There is a increase in the blood pressure is very slow. The patient may not even to detect that he is having the hypertension. So, here in benign hypertension, the increase in blood pressure is very slow. Then next, coming to the malignant hypertension. Malignant hypertension, it is sudden increase, a sudden increase in the blood pressure, and that blood pressure may be greater than 200 mmHg. So, that we called as malignant hypertension. So, these are the 4 forms of hypertension that we have discussed. The primary hypertension, the secondary hypertension, which is due to certain diseases, and then is the benign hypertension, and finally is the malignant hypertension. Now, coming to the next slide is the etiology. The etiology, what does this word means? Etiology, the causes. What are the different causes which is responsible for hypertension? Okay. So, number 1 is the primary causes. The primary causes is the family history. The patient, mother or the father is suffering from hypertension. So, that hypertension is transferred to the progeny, it is transferred to the children. If one of the parent is suffering from hypertension, or both of the parent they are suffering from hypertension, so that will result into the transfer of this disease into the children. Then different environmental causes are also there, various racial causes are also there, that may lead to the disorder called hypertension. The secondary causes of hypertension, it include the various disorders, the different disorders which are responsible, the different disease which are responsible for hypertension. So, the number one disease is the renal disorder. The renal disorder, the patient is suffering from glomerulonephritis. Okay. Now, what is this glomerulonephritis? See, just break the word. glomerulo, it means glomerulus. This is the portion in the nephron. Okay. So, the portion in the nephron, this is glomerulus, nephritis, that is the inflammation of the glomerulus. So, what happen if a patient is suffering from this renal disorder or glomerulonephritis, the filtration process of the kidney is not proper. When the filtration process of the kidney is not proper, what happens? There is retention of the sodium. The filtration is not proper, so increase in the sodium will be there and that will lead to the increase in the blood pressure. So, this will cause the increase in the blood pressure. Then pregnancy induced hypertension is there. Pregnancy induced hypertension is basically the preeclampsia. Okay, this is called the term preeclampsia, means the hypertension which is only during pregnancy. That is, it is induced by pregnancy. Why it is hypertension is there? Because during pregnancy there is certain vasoconstriction in the blood vessel and that may lead to the increase in the blood pressure. Then the drug induced hypertension are there. Drug induced means various drugs like your various contraceptives pills the patient is taken, or different other drugs like sympathomimetic drugs the patient is taken. So, that drug will induce the, it will cause increase in the blood pressure. Okay. Then the CVS disorder, different CVS disorder is there. The CVS disorder, cardiovascular disorder, that will lead to the disorder of hypertension. How? The aortic stenosis. Aortic stenosis, what is aortic stenosis? It is the narrowing of the aorta. So, when the aorta it narrows, automatically there is increase in the blood pressure. Aorta, you know, the aorta portion is the, it supplies blood to the body, okay, starting from the left ventricles. Then is the adrenal causes are there, that adrenal gland, you know, adrenal gland, it is located above the kidney, and what adrenal gland it does? Adrenal gland, it secretes various hormones, okay, it secretes adrenaline. So, now this pheochromocytoma, what is there? It is the tumor of adrenal medulla. This is the tumor of adrenal medulla. So, when there is a tumor of adrenal medulla is there, so what happens? There is increased secretion of, due to this tumor, what will happen? There is increased secretion of adrenaline. There is increased secretion of adrenaline, and this increased secretion of adrenaline will ultimately causes increase in the blood pressure. Then is the sympathetic overactivity. Sympathetic overactivity means in certain patient due to excessive sympathetic overstimulation. You have studied about sympathetic and parasympathetic nervous system in your previous class, in your HAP class. So, what happened here in sympathetic stimulation is there is increased secretion of adrenaline, and this increased secretion of adrenaline again will cause the increase in the blood pressure. Okay. Then acromegaly. So, these are the all different diseases which are leading to hypertension. Acromegaly, here there is increase in the growth hormone. Growth hormone increases in acromegaly. So, growth hormone it increases in acromegaly, and it ultimately lead to increase in the sympathetic stimulation. So, what happen? Ultimately it will cause increase in the blood pressure. Then is the Cushing syndrome is there. Cushing syndrome is what? Cushing syndrome, there is increase in the level of corticosteroids hormones. When there is increase in the level of corticosteroids hormone, increase corticosteroids. Okay. So, this increased corticosteroid when there is there, so what will happen, there is increase in the sodium absorption, and when sodium absorption is increased, what will happen, sodium ultimately will cause increase in the blood pressure. Okay. So, these are the different secondary causes which are responsible for causing hypertension. Okay. So, the primary causes and secondary causes. Now, coming here to the factors influencing blood pressure. What are the different factors which influence blood pressure? The age. See, as the age goes on increasing, like above 60 or 70 years of age, the patient, they are more hypertensive. So, age is one of the important factor which is responsible for hypertension. Second is the exercise. The people who are doing very less exercise or they have a very sedentary lifestyle. Sedentary means they are just sitting every time and no work at all. So, for that patient they generally they are suffering from hypertension, because when there is no exercise, what will happen, excess of cholesterol deposition will be there in the body, and that ultimately will lead to increase in the blood pressure. Excessive of salt intake, sometimes the patient excesses of salt, that means increase in the sodium level is there. So, what will happen, ultimately this will cause increase in the blood pressure. Okay. Then lifestyle factors are there. Lifestyle factors, they are eating these fatty foods and fatty diets, and ultimately it will lead to increase in the cholesterol level. So, that will ultimately causes increase in the blood pressure. Obesity is one of the also reason. Obesity, there is increase, the patient is obese, and ultimately it will lead to hypertension. Stress also, sometimes stress is there is increase in the certain neurotransmitter level when a patient is suffering from stress. So, that will ultimately lead to the hypertension. Now, coming here to the clinical presentation. Clinical presentation, what does this word means? It means what are the different signs and symptoms. Okay. What are the different signs and symptoms if a patient is suffering from hypertension? So, patient is suffering from hypertension, there is tachycardia. Tachycardia, that means there is increase in the heart rate. Then palpitation, see palpitation, the heart rate, it increase so high that a sound is seeing a ringing sound in the ear, जैसे कान में ना गुनगुन गुनगुन सुनाई देता है, तो that is called the palpitation. Why it is happening? Because of the increase in the heart rate. The patient is suffering from hypertension. Sweating, excess of the sweating is there because of increase in the adrenaline level. So, that causes excess of sweating. Visual disturbances, sometimes the the eye are affected, patient is suffering from hypertension. So, visual disturbances are there. Then headache is also the very important sign the patient is suffering from hypertension. Drowsiness, chakkar आना, ठीक है, चक्कर से आते हैं ऐसे patient को, and so these, and pain in legs due to accumulation of certain fluids, there is pain in legs. So, these are the different sign and symptoms that a patient is suffering from a hypertension. Okay. Now, coming to the pathophysiology. Pathophysiology is how the hypertension is caused. See, for understanding the pathophysiology, we have to understand the most important system is the RAS system, that is, this is the renin angiotensin activating system. Okay. Now, why this RAS system is activated? Now, what happened? Here in the diagram it is clearly shown that when there is a hypotension or when there is decreased renal perfusion means when the blood flow to the kidney, it decreases. So, when there is decreased renal perfusion, what happens, or when there is a less of the blood pressure, the RAS activating system this stimulated. What will happen? There is renin secretion is there, and this renin secretion which is from the kidney, what it will do? This renin secretion, it will convert angiotensinogen to angiotensin 1. This angiotensin 1 is converted into angiotensin 2 with the help of enzyme ACE. This ACE is angiotensin converting enzyme. Okay. Angiotensin converting enzyme, why we call this? Because it is converting angiotensin 1 to angiotensin 2, and this angiotensin 2 is responsible for vasoconstriction, it is responsible for increase in the blood pressure. So, if we want to control the blood pressure, we have to control the angiotensin 1 level, we have to control this enzyme ACE, okay. We have to control this angiotensin 2 level. So, this is the pathophysiology, how the blood pressure is increasing in the body. Again here describe renin-angiotensin system I have discussed with you. Sympathetic stimulation, when there is a excessive sympathetic stimulation, it will cause increase in the blood pressure. Blood pressure is equal to cardiac output into TPR is the total peripheral resistance. Okay, total peripheral resistance, what is this? Peripheral resistance, it is the resistance to the flow of the blood. So, when there is excessive of sympathetic stimulation, the cardiac output may increase or TPR may increase, leading to increase in the blood pressure. Third is the arteriosclerosis. Arteriosclerosis, it is the hardening of the or stiffening of the arteries, and this may lead to the increase in the blood pressure. Then is the assessment of hypertensive patient. How will you assess that a patient is suffering from hypertension? So, you have to take a careful history of that patient. The patient careful history means he is suffering from hematuria, that is the blood in the urine, polyuria, excessive urine, or suffering from any renal diseases. Also, we will assess the organ damage, that is renal damage is there, or we will check the ECG. So, a patient is suffering from hypertension, we will assess all these parameters. A patient is. Now, the treatment is non-pharmacological treatment. Non-pharmacological treatment means we are not using any drugs over here. Exercise to a limited form. Okay. Salt intake we have to decrease because salt is directly causing increase in the blood pressure. Avoid smoking, because smoking, what happens? Smoking, it increases the cholesterol level, it increases the HDL level, okay, sorry, it increases the LDL level. So, smoking we have to avoid, and then there is a decreased of alcohol intake. So, these are the non-pharmacological parameters that we have to control. Finally, is the pharmacological treatment. Pharmacological treatment means how we can treat hypertension with the help of certain drugs. So, first of all is the diuretics. Diuretics is the drugs which increase the flow of urine. See, when the flow of urine is increases, what will happen? There will excessive sodium will excrete out from the body. When sodium will be excreted out from the body, the blood pressure automatically will be controlled. So, furosemide drug is given for control. Renin inhibitors, see renin inhibitors, as I have discussed in the previous slide, that renin is responsible for formation of angiotensin. Okay. So, angiotensin is responsible for increase in the blood pressure. If we inhibit this renin, what will happen? The blood pressure will automatically control. Aliskiren is the drug which is given to control the renin. Then is the beta blockers. See, I have told you the sympathetic stimulation is there. When the sympathetic nervous system is stimulated, it will cause increase in the blood pressure. Now, how the sympathetic nervous system is stimulated? It is stimulated through alpha receptors or beta receptors. So, when we need to decrease the blood pressure, what we have to do? The sympathetic nervous system is stimulated. How? With the help of alpha and beta receptors, and this finally causes increase in the blood pressure. So, what we have to do if we have to decrease the blood pressure? Block the alpha receptors, block the beta receptors. So, beta blockers, atenolol drug is given, and alpha blockers, terazosin drug is given. So, these are the different drugs which are given. Then ACE inhibitors, angiotensin converting enzyme inhibitors, that we have to give captopril, and angiotensin receptor blocker losartan. See, all these drugs you will discuss in detail in your future class. In this you have to discuss only pathophysiology. Okay. So, references, and then this is all for today's lecture on hypertension. Next class we will discuss the next disease of the cardiovascular system. That is all for today's lecture. Have a nice day.